Hi, Dr. Zhou. We have the medical record for SpongeBob SquarePants.
SpongeBob SquarePants? The one who lives in a pineapple under the sea?
Lives in a pineapple under the sea. SpongeBob SquarePants absorbing a yellow and poor disease.
What's his recent visit?
His recent visit seems to be for mania and depression, as well as a routine checkup.
Oh, okay. So he indeed has bipolar disorder. I'll go through the diagnosis process and maybe you can tell me about treatment.
Okay.
Later.
People from bipolar disorder are 20 to 30 times greater risk of suicide than the general populations. Not everyone has bipolar disorder and necessarily go through highs and lows. People have misunderstanding that patients' mood change like a sine wave, but it's not always the case. Some can in their manic states and then return to a normal state instead of going to a depressive state. Now, I will briefly introduce 3 effective talk therapies for bipolar disorder. The first one is interpersonal and social rhythm therapy. This therapy helps individuals stabilize their daily routine, like sleep and meal times, since disruptions in this rhythm can trigger mood episodes. By improving consistency and managing interpersonal stress, this therapy reduces the likelihood of relapse. Another one is cognitive behavioral therapy, often known as CBT. This focuses on identifying negative thoughts pattern and replacing them with a healthier, more balanced perspective. It teaches coping strategy for managing mood swings, reducing stress, and preventing extreme emotional reactions. Also, one popular therapy is family-focused therapy. This involves both the patients and their family. It provides educations about bipolar disorder, improves communication skill, and help family recognize early warning signs of the mood episodes. This support system reduces stress and enhances long-term treatment success. While talk therapy alone isn't a cure, it plays a crucial role in managing symptoms, improving relationships, and preventing relapse when combined with medications. Now, my colleagues will introduce more about the lithium drug therapy.
Later.
So, how is lithium, a natural resource, so effective in treating bipolar disorder? As of now, lithium is the most effective long-term treatment for bipolar disorder for its neuroprotective and neurotrophic effects, allowing it to enhance neuron survival. And it's commonly given in the pill form, lithium carbonate, Li2CO3, or for those who can't swallow pills, given in the liquid form, lithium citrate, Li3C6H5O7. Although lithium has been used for decades, its mechanisms of action is still not yet understood, but let's go take a look at some of the hypothesized ones inside the cell. This is what it looks like, but we'll just choose a few to go into. Okay, and now we're into the cell. So the way this diagram works is the ones in orange are pro-apoptotic, which means pro-programmed cell death, and the ones in blue are anti-apoptotic, which means anti-programmed cell death. Lithium will often downregulate or decrease the expressions of the pro-apoptotic proteins, the ones in orange, and lithium will increase the expression of anti-apoptotic proteins, the ones in blue. One aspect that lithium regulates is by increasing the ERK or MAPK signaling cascade. So once lithium activates the ERK signaling cascade, it increases the generation of new neurons and cell survival. So activating ERK will activate CREB, causing the increase of BCL2, B-cell lymphoma 2, and BDNF, brain-derived neurotrophic factor expressions. Increasing these expressions of these anti-apoptotic proteins, shown in blue, is good because they have neurotrophic effects and are neuroprotective proteins. Also, by activating the ERK pathway, we also inhibit BAD, which is BCL2 associated death promoter, and blocking the release of pro-apoptotic proteins from the mitochondria, such as BAD, we are promoting cell survival.
Hey, Dr. Banh. I have a case here I'm working on, Jack White. I was hoping you could help me out with this. So, this man has been suffering from hallucinations and delusions of grandeur. At his routine checkup, he exhibited erratic behavior. I was wondering if you could take a look at this.
Yeah, of course. Isn't he the Joker, though?
Why so serious?
Yeah, I'm ready to take a look at it. It said he was brought in by his brother because he was having those delusions, and he also claimed to be hearing voices,
and had difficulty following commands even though no one was in the room. And his speech was extremely disorganized, so I think he has schizophrenia.
Dopamine activity is believed to play a large part in schizophrenic symptoms. Increased subcortical release of dopamine activates D2 receptors in the brain, which is said to lead to hallucinations and delusions. Our particular patient, Jack the Joker, is a frighteningly fringe case who exhibits extremely exaggerated schizophrenia symptoms. Schizophrenia symptoms typically entail debilitating delusions, disorganized dialogue, discombobulated motor movements, and numerous negative symptoms. Some examples can be seen in the movie The Dark Knight Rises. In this film, the Joker exhibits erratic movements such as constantly licking his lips and odd speech patterns. He also suffers from delusions, believing that he is working to tear down and expose a corrupt society. Prescription of haloperidol. Haloperidol, also known as haldol-olperidol, was discovered by Paul Janssen in Belgium in the 1950s. Clinical trials began in 1958 and the molecule was finally approved in 1967. Haldol is a first-generation antipsychotic that can be taken in tablet form twice a day in 0.5 to 2 milligram doses. Haldol can also be found in injectable form as haldol decanoate. The injection can be given every 3 to 4 weeks. Haloperidol has a molecular weight of 375.9 grams per mole, as a chemical formula of C21H23ClFnO2. Its chemical structure has a central piperidine molecule. It also has a hydroxy and p-chlorophenyl substituents at carbon 4. It also includes an N-linked p-fluorobutrophenol. In order to synthesize haldol, we would first react to 4-chloro-alpha-methylstyrene with formaldehyde and ammonium chloride to form 4,4-chlorophenyl-piperidine-4-ol. We would then use a Friedel-Crafts reaction generating 4-chloro-4-fluorobutrophenone. Combine the two intermediates via substitution reaction with potassium iodine and toluene to form our final product. Haldol works by acting as a dopamine antagonist and binds tightly to the D2 receptor. It has a low dissociation rate, so it prevents the binding of dopamine in the mesolimbic and mesocortical systems of the brain. This reverses the effects of dopamine hyperactivity in patients with schizophrenia. Haldol binds tightly to the D2 receptors of the brain and can cause adverse side effects as a result of being slow to dissociate from the receptor. All in all, haloperidol can work wonders for the Joker by helping reduce his extreme delusions, aggressive behaviors, odd motor movements and tics, and negative symptoms.
In the case that first-generation antipsychotics like haloperidol, shown on the left side of the screen, don't work or side effects occur, second-generation antipsychotics can be taken. These block both dopamine D2 and serotonin 5-HT2A receptors, helping treat both positive symptoms like delusions and hallucinations and negative symptoms such as lack of motivation or social withdrawal. They have a lower risk of motor issues, but a higher risk of metabolic side effects, including weight gain, diabetes, and high cholesterol, when compared to first-generation antipsychotics. As for common second-generation antipsychotics, for most patients, risperidone, olanzapine, and aripiprazole are first-line treatments. While clozapine is also common, it is reserved for cases that do not respond to other medications.